you a breastfeeding mother struggling with the effects of alcohol on your baby. In this video, I'm going to show you the common warning signs and what you need to know about alcohol in breastfed babies. 1. What potential risks are associated with drinking alcohol while breastfeeding? Drinking alcohol while breastfeeding can potentially have a range of risks associated with it. It can cause the infant to be more drowsy, which could lead to difficulty feeding, and an increased risk of sudden infant death syndrome (SIDS). Alcohol also has the potential to pass through breast milk and decrease milk production, leading to dehydration in babies. As well as this, drinking alcohol while breastfeeding can alter a mother's judgment and reaction time, making her less able to respond quickly and responsibly if her baby needs help. Finally, high levels of alcohol exposure through breastfeeding can lead to long-term physical or neurological damage in infants. For these reasons, it is important that mothers who wish to drink alcohol while breastfeeding take precautions and use good judgment. The American Academy of Pediatrics states that mothers should not consume more than 0.5 grams per kilogram of alcohol per day while breastfeeding. Mothers who choose to drink above this level should avoid breastfeeding for 2 hours after each drink and ensure they are awake, sober, and well-nourished before nursing their baby again. Additionally, it is important to monitor the infant's behavior carefully when drinking alcohol while breastfeeding. This can help alert the mother if there are potential risks or problems related to the exposure to alcohol in breast milk. 2. How can alcohol consumption affect a baby's development? Alcohol consumption during breastfeeding can have a significant impact on the baby's development. When alcohol enters breast milk, it is quickly passed to the baby and can reach the same levels as in the mother's bloodstream. Because of their immature metabolic system, babies are unable to break down alcohol as effectively as adults do, meaning they may be exposed to higher concentrations for longer periods of time. This frequent exposure can lead to long-term developmental problems such as learning difficulties, behavioral issues, and poor physical growth. Other possible effects include poor sleeping patterns, colic or fussiness, and decreased immune function, which could make them more prone to illnesses. As well, excessive drinking over a period of time may also reduce a woman's milk supply, leading to a potential decrease in nutrition for the baby. 3. How long should a breastfeeding mother wait after drinking alcohol before breastfeeding? The amount of alcohol that passes through to the baby depends on factors such as how much alcohol was consumed when it was consumed in relation to breastfeeding, and how quickly the mother metabolizes the alcohol. It is generally recommended that a breastfeeding mother wait at least 2 hours per drink before resuming breastfeeding. This allows for more than sufficient time for the body to process and eliminate any residual alcohol from breast milk. In addition, if a mother has had several drinks, she should consider expressing milk beforehand and then discarding it until she feels sober again before nursing her baby directly. 4. Is there a safe level of alcohol consumption while breastfeeding? No, there is no safe level of alcohol consumption while breastfeeding. Even moderate drinking can affect the baby through breast milk and can cause developmental issues as well as impair your ability to respond adequately to your child's needs. If you are concerned about potential exposure to alcohol through breast milk, talk with your doctor or healthcare provider. At the same time, some doctors do believe that very occasional and light consumption of alcohol, 1 to 2 standard drinks, may not be harmful if done occasionally and not on a regular basis. The American Academy of Pediatrics has suggested that after one alcoholic drink, wait at least 2 to 3 hours before breastfeeding again so that any residual alcohol in the mother's system will be gone before the next nursing session. 5. What are the signs that a baby has been exposed to alcohol through breastfeeding? Babies who have been exposed to alcohol through breastfeeding may display several signs, including increased drowsiness or sleepiness, decreased appetite, poor weight gain, vomiting and/or diarrhea, fussiness or irritability, and reduced activity. Some babies may also show difficulty with sucking or latching onto the breast, as well as difficulty staying awake while nursing. If you notice any of these signs in your baby, it is important to talk to your doctor right away. Additionally, it is a good idea to limit your own drinking while breastfeeding if possible. 6. Is there any way to increase the metabolism of alcohol in breast milk? Yes, there are ways to increase the metabolism of alcohol in breast milk. Some methods include pumping and discarding the first few ounces of breast milk after drinking alcohol, waiting at least 2 hours before breastfeeding after a single drink, and abstaining from breastfeeding for 2 to 3 hours if you've had more than one drink. However, it is important to keep in mind that these methods may not be 100% effective, as some alcohol can still remain in breast milk even after these precautions have been taken. In addition, it is important to note that none of these methods will prevent exposure completely, and the best way to protect your baby from any potential harm is by avoiding drinking while breastfeeding altogether. 7. Are there any strategies that breastfeeding mothers can use to reduce their baby's exposure to alcohol? Yes, if you are breastfeeding, it's important to limit your alcohol consumption. Consider avoiding alcohol entirely while breastfeeding or cutting back on the amount that you drink. It may also be helpful to wait an extended period of time after consuming alcohol before nursing your baby. Additionally, if you plan to have several drinks, it can be beneficial to pump and discard breast milk for several hours after drinking in order to reduce the possibility of exposing your little one to alcohol through your breast milk. We hope this video helped you better understand the warning signs of alcohol in breastfed babies. Remember to always consult with a doctor if your baby is exhibiting any unusual behavior or symptoms, and never give them alcohol directly. If you found this information helpful, please leave us a comment below. And don't forget to subscribe for more great parenting advice. Thanks for watching.